Hello, everyone. Today we're going to be talking about the use of stem cells as a therapeutic option for Parkinson's disease. So, a background into Parkinson's disease. What is Parkinson's disease? It is a chronic neurodegenerative disorder that affects movement and can lead to cognitive impairment. So, how is it caused? It is caused by the progressive loss of dopamine producing neurons in the substantia nigra region of the brain. And in that diagram, you could see where in the brain that it is affected. All right, and jumping into the disease pathology. So, what is the underlying cause of Parkinson's disease? So, the underlying cause of Parkinson's disease is the aggregation of alpha synuclein protein, which forms structures known as Lewy bodies. These aggregates disrupt cellular function, leading to neuronal death and the characteristic motor symptoms. So, globally, around 10 million people are affected by Parkinson's disease, and that only increases with age. And the impact extends beyond the patients themselves, affecting families, caregivers, and healthcare systems, and so many more. All right. So, current treatment challenges. Right now, the main form of treatment involves dopamine replacement therapy, which unfortunately only alleviates symptoms. However, these treatments do not address the underlying cause and fail to slow disease progression. Non-motor symptoms, such as cognitive decline and depression, pose additional challenges in management. So, using stem cells for treatment. Stem cells are a viable treatment option because they are undifferentiated cells with the potential to develop into various cell types. They hold promise as a treatment option for Parkinson's disease due to their capacity to replace damaged neurons and potentially halt disease progression. So, a little overview into stem cell therapy. Stem cells can be derived from various sources, those sources being embryonic, iPS, or adult stem cells. And these cells can be guided to differentiate into dopamine producing neurons for transplantation. And in that diagram, you could see how those cells would be transplanted. All right. So, some advantages of stem cell therapy. Stem cell therapy offers the potential for both symptom relief and disease modification. Transplanted dopamine producing neurons could restore lost function, which improves motor symptoms. Disease modifying effects could potentially slow down or halt disease progression. However, there are some obstacles in stem cell therapy. Ensuring proper differentiation of stem cells into functional neurons is challenging. There's risk of immunorejection, immunosuppression, and so much more. Not to mention the ethical concerns that come with using embryonic stem cells. So right now, current research involves clinical trials to assess safety and efficacy of stem cell-based therapies for Parkinson's disease. Personalized approaches using patient-specific stem cells could enhance treatment effectiveness. And obviously, there needs to be continued research to address the different obstacles that are being seen using stem cells as an option for treatment. But the more research that is done, the sooner we'll get to finding a much better treatment option. Anyways, to conclude this, Parkinson's disease remains a significant challenge which impacts millions around the world, and using stem cells as therapy is a promising avenue for both symptom management and potential disease modification. And even though some obstacles might exist, ongoing research